Whenever. Thank you for having me to everybody here, and thank you to everybody who's zoomed in. I'm with my manager, Shelby. So between the two of us, I hope that you feel comfortable with asking questions. I hope that the learning environment is positive and that you feel like you've learned something today. So my presentation today is on lymphedema. So I'm from the Helen F. Graham Cancer Center. I've been there for several years. Just a brief background. I'm an occupational therapist. Come January, I will hit my 15th anniversary, which is crazy. Thank you. The process of getting from like general OT, I worked at the inpatient rehab clinic at the Wilmington Hospital. And then I worked in acute care at the main hospital doing ICU and non-ICU care. And then I moved to the Helen F. Graham Cancer Center, which is a more specialized area of therapists or therapy. All the therapists have to do a training called Certified Lymphedema Therapist. So each day when we're seeing patients, we're doing evaluations and treatments and trying to help patients with the condition in relation to lymphedema. So this presentation is about lymphedema in general. I hope that you have a better understanding. One of our early slides just goes over the different topics that I want to cover. So the things we'll be reviewing is what is lymphedema, what causes lymphedema, what are the general risk factors, how can you tell from a self-assessment, do I have lymphedema or do I possibly have lymphedema, like what are the symptoms you want to be on the lookout for, what is the treatment for lymphedema, how can I prevent it, and then we'll go over some of the most commonly asked questions that we get in relation to lymphedema. From my training, I think from a therapist perspective, I think it's touched on in school and then you see it a little bit, but until you're really living it every day, like at our specialty clinic or in like a cancer related treatment center, you don't really get a great understanding of it. So I think the special training that we have to do is really helpful to give you a good baseline of knowledge. But I think when patients see us, unless they've dealt with it, it is a condition that they really need to learn a lot about. But the good thing is there's a lot of tools and treatments and ways to make the condition more manageable. So in relation to lymphedema in general, I think it's important to just briefly touch on general anatomy. So we all have the lymphatic system that does a good job of helping us stay healthy. The system is comprised of lymph nodes as well as lymphatic vessels. Our lymph nodes are in our neck region, our clavicle region, like up near your collarbone, through the abdominal region, armpit, some in the elbow, groin, and then around the knee. So when we're treating patients, we're talking about the lymphatic system and just like a general anatomy review, because I think it's helpful for people to understand what the system is actually made of so that the treatment that we're teaching them makes sense. So I briefly touched on this, how the system functions to help keep us healthy. So it's moving fluid. It is helping us fight any kind of anything that our body doesn't need, like extra fluid, extra fat molecules, water molecules, proteins. It helps us just generally fight infection, filters out waste, regulates our protein levels. The amount of lymphatic fluid we have in our body out of all the fluid is about 10%, and then the cardiovascular system makes up the other 90 or so percent. The lymphatic fluid, when you move it, whether it's through something like you might have heard of like a compression pump, or you might have heard of something called manual lymphatic drainage. When you're moving the fluid, it has to go from the lymphatic system. So on that first slide where you saw a lot of green vessels and green lymph nodes, it has to move from that whole system to the cardiovascular system, which is like your heart, arteries, and veins. And then that fluid goes through the kidneys, and then you would urinate it out. So that's really how you move the fluid in our bodies from inside to outside. So it's a process, but in therapy, a therapist would be responsible for teaching you strategies to manage this extra fluid. So the system is comprised of some deeper parts, and then the vessels go from like more deep to like intermediate level to very superficial level, like right underneath the skin. So the techniques that we're teaching, it's not at a level like if you went to a massage therapy place and they're doing a real deep massage to the muscular level, this is much more gentle. It's very superficial. You're just moving the skin just gently, and that's actually how you move the lymphatic fluid. So it's nothing too deep or aggressive. It's very gentle. And there are about 600 to 700 lymph nodes in the body. You might have heard of lymph nodes just in general from cancer treatment, or when they take like a lymph node biopsy or they do a lymph node dissection. So I think this presentation definitely relates to this location. So a little bit more on what the lymphatic system does. It removes protein and fluid from the interstitial space. That just means there are veins, arteries, and lymph vessels that are all really close to one another. They're right next to each other, intricately intertwined. They're not part of the same system. They're not connected to one another, but they're all in kind of the same spaces. So if there's extra fluid sitting around either of these, the lymphatic vessels, you don't want extra fluid sitting there. So lymphatic vessels will be responsible for taking up some of that extra fluid that's sitting in those spaces and helping you get rid of it. Like I said earlier, it transports fats, and some other things like that our body's trying to fight and get rid of. The biggest thing would be, especially in relation to this type of community, would be that it helps keep us healthy. So in those nodes, it's looking at things that our body doesn't really want. We don't want necessarily something that's going to cause an infection. So those nodes are constantly working each and every minute to help keep us healthy. So this relates to what I was hoping that you'd have an understanding of kind of like what the system is and what lymphedema is. So these two things are, I think if you have a good understanding of what the lymphatic system's jobs are, that relates to lymphedema, because lymphedema is an abnormal collection of high protein fluid. So this is fluid that's been sitting for a period of time in a certain area. There's lots of different causes of which we'll go over, causes of an abnormal collection of high protein based fluid, but you don't want it to sit there because it's going to cause other issues. One of those issues could be where you have a change in your skin texture. So if proteins within that fluid are just kind of sitting in those spaces, if they sit there for longer periods of time, they actually will harden the skin. So you don't want the skin to be hardened, because then it becomes even harder to move that fluid out and make good progress. So there's these two things listed here: fibrosis and skin changes. Fibrosis is just like a hardening of the skin texture. You want everything to feel like really mobile, really soft. You don't want that fluid sitting there. So some general causes of lymphedema. The first one's listed as parasitic infection. This wouldn't be commonly necessarily happening in our countries. It's more in Africa, and that's an infection that could be spread basically through bugs or like mosquitoes, where they're carrying this infection from person to person, and then that's what causes lymphedema. But that's not common here. Genetics, cancer treatment, venous disease, obesity, and any kind of trauma to the body. So those are just general causes. Risk factors in relation to cancer treatment. Like I was mentioning earlier, if you had ever experienced like a lymph node biopsy or a lymph node dissection, once some of those lymph nodes are removed, even though we have so many in our body, the system is potentially going to be slowed because they're missing some of the lymph nodes. So for example, if you had a biopsy of some lymph nodes in the armpit area, then the swelling in the arm could be more apparent if that arm isn't decongesting well. So if it's missing some of the lymph nodes in a certain area, then a limb, like an arm, for example, could become more swollen. Another thing that might slow the system down and cause issues with swelling, you can see lymphedema with radiation. So that would be another thing that would be an impairment to potentially cause swelling. Radiation can cause some hardening of the skin, some extra congestion, and things just don't flow well. And then another thing, not that we're like the weight police as therapists, I usually just say to patients that we are recommending an active healthy lifestyle where your weight is managed well, because there's lots of research linking like increased weight with increased swelling. So we would just as therapists say, this is like what my responsibility is to share with you. Like we would recommend X, Y, and Z in your routine to help you manage like a healthy weight or healthy lifestyle. And then more details about symptoms of lymphedema. It would be a slow progressive onset, that it is staged. The beginning stages would be maybe you don't see a noticeable change in swelling in your arm, for example, but you might say to yourself, like, well, this feels really heavy, or this is starting to feel achy. And you have some symptoms that you can describe kind of like subjectively. But then if it's progressing more, you might notice that it has some swelling periods of time and then it goes back to normal. And then it swells again, it goes back to normal. So that would be the second stage. The stage 0 was the first one I was saying about the subjective changes. Stage 1 would be it's there, but it goes away. Stage 2 would be it's always there. So the swelling's just kind of hanging out, it's always present. Stage 3 would be where your skin texture is changing, that hardening of the skin. And then between whatever stage someone's in, it depends on, like, it might influence the treatment. It might influence how efficiently things are returning to normal. Like a stage 3 person would have maybe more of a need for a longer plan of care or some different direction, because that fluid that's been sitting there, that's been hardening the skin over time, that's going to be harder to move than, say, someone that has a normal level of swelling and then a little bit worse and then a little bit better. That type of swelling is a little bit easier to move. Another thing you might notice besides the sensation, like the subjective things like heaviness, fullness, tightness, feeling differently, the actual look of the limb might change, or maybe breast might change. Like it might change shape, it might change size, the appearance might change. The pores on the skin might look a little bit bigger, it might feel a little harder or firmer in some areas. And then if you're noticing you have changes depending on activity levels, or if it's like really warm outside, that might be something that changes swelling. So those would be the things to be on the lookout for. So if you're suspicious that you have it, you would get a prescription from the doctor. The doctor would refer you to a lymphedema clinic, for example, like the Helen F. Graham Cancer Center. You would want to be looking for a therapist that has those letters CLT behind their name, so that you know that you're working with someone that has that specialty certification that really understands lymphedema well. That could be a physical therapist, an occupational therapist, or a speech therapist. There are also that certification isn't just a therapy, like a doctor could have that certification, a massage therapist, a nurse. A little bit about our training, it's 135 hours of continuing education. And then besides those letters of C, L, and T, there's another certification that's a LANA certification, that just stands for Lymphology Association of North America. And that just means that that therapist or whoever the provider is has extra training on lymphedema. You have to take like an exam and do like a training with that. So those would be two of the things that I would look for. If you're not in a clinic with a bunch of CLTs, say you go to a massage place, you would be looking for CLT or CLT plus LANA behind their name. So when you're with therapists, and I can speak from experience of kind of like what our day-to-day looks like, when we're meeting someone upon evaluation, we're kind of gathering their history. We're saying, like, what brought you in here? What's going on with your swelling? Can you describe it to me? What's helping the swelling? What's not helping the swelling? And then we would take some very specific measurements and kind of use those as a baseline, because we would ultimately want to help you with your swelling so that we can use those objective measurements and then make sure that those are going down. We have to palpate the area, look at the shape of the area. We have to put all this in our assessment so that when someone's making progress, we always have that as kind of like our baseline evaluation so that we're measuring improvement. And then the therapist would be responsible for coming up with a plan. So they'd say, okay, so your presentation looks like this, and this is what I'm going to recommend. And then after working with a patient and maybe their family member to establish the plan of care, then you just schedule the treatment with the therapist from that point forward. So then a little bit more about the treatment part. So if someone has a swelling condition, there are a couple of different ways to treat it. There's a more intensive route, and people who need more intensive route through phase 1 complete decongestive therapy. That would include the therapist talking about skincare, doing a very intensive bandaging program. It's called multi-layer compression bandaging, doing manual lymphatic drainage, and starting an exercise program and monitoring or helping the patient monitor their skincare. So that would be a pretty big commitment to therapy. But once that initial phase 1 is happening, then in phase 2, after you get through phase 1, some of those same components would carry over. So now we're in more of the program where we're looking at how can this patient carry over some information that they've learned in phase 1 to phase 2, because in phase 2, they're going to be getting, instead of carrying over the bandaging, they're going to be in compression garments. The therapist is going to make sure that the patient knows how to do their own manual lymphatic drainage. The therapist would want to make sure that the patient has an exercise program or an activity program, and then they want to make sure that the patient understands how to care for their skin. So when we evaluate someone, we might be thinking this could look like a 10 or 12-week plan of care, but it depends on really someone's presentation and what they specifically need of how long the plan of care will actually be at the clinic. That's just some general overview of like when we do our training, this is like the bulk of what they're teaching us, is complete decongestive therapy, how to help patients go from phase 1 to phase 2, which includes the home management program. So in relation to phase 2, you've probably heard of compression garments. If you had a patient that just did the bandaging but never gets the garments, then all that progress you made from bandaging wouldn't really be effective. So your therapist would be responsible saying, these are some options for garments, and this is how you obtain them. The therapist would do the measuring and helping you get the item, so it doesn't feel so overwhelming, like you have to figure this thing out on your own. They come in different styles. Some are elastic. Some have more of a fastener, such as like a Velcro fastener. There's all types that
I don't show any of them.
Sure. Yeah, so they have some for the breast, they have some for the arm and glove. They have legs, like knee highs, thigh highs, compression shorts, all sorts of things. So this is an example of something that's elastic. This is just a little glove. This would typically be paired with a long sleeve. This would be an example of a sleeve. You can see that hopefully on the screen, you can see that. These would be an example of something that a compression garment you'd wear during the day. This is an example of a compression bra that you could wear day or night. And again, the therapist would do all the sizing for this. So once a patient has found what they need and the therapist like, yep, that looks great, then the therapist would give you information on how to get this, 6 months from now, 12 months from now, 18 months from now. This is an example of something that you could sleep in, because compression would be recommended for both day and night. Some of the night garments, this one's pretty plush. Some of them look more of like the consistency of like an oven mitt, how it's like knitted and you can kind of press into it. There's foam embedded in there, and that helps with swelling management. So it should be pretty comfortable. Compression should never be painful. So if you've ever had a garment that's just really not working, pain would be a red flag. So that something's off with it, whether it's the level of compression, the fit might be off, the style might be off, but don't torture yourself and try to make yourself fit into something if it's just really not working. And then this is more of an example of, thank you, the heavy leg. This is an example of something that you can wear on the calf. There's a liner on here, and the liner has compression in the foot. Sorry, hopefully you can see this on camera. And then it has these Velcro straps. They're just all the way up the leg. There's many different brands, but this is kind of the gist of. There's some elastic ones that you pull on, but sometimes they're not appropriate for patients, or they can't quite get them on their own. So then Velcro would be the next best thing. And you can sleep in these, and that's a little bit of an advantage to the elastic style. You could wear the elastic only for day. You need a night garment that's different. But the Velcro, if someone was really only trying to get the bare minimum because of whatever reason, then a Velcro would be safe to wear day and night. And they make them for different, like this is an example of a leg, but you could get an arm one too. Thank you.
Yeah.
Thank you. So those are some examples of compression garments. The other one listed on here are head and neck and the genital region. I don't have any samples of that, but again, your therapist would be able to say, here are some examples, and this is what we recommend. So the next slide just has a few more pictures of the compression garments. I think we talked pretty much about those. And then the next section would just be how to go over some frequently asked questions that we get. So if a patient was saying to us, I have what I think is a swelling condition, but how do I, or I don't have the swelling condition, but how do I prevent it? We would say some of our education in relation to what we learned in our training. So you would really want meticulous skincare. You would want to be on the lookout. Do I need compression garments, or what are compression garments? You would want to be mindful of like your activity levels, weight management, good lifestyle changes, if you can make any, to lead a healthy lifestyle, and then avoiding any unnecessary constriction. So that would be like if you had a really tight sweatpants on and the pant leg is like cutting off at the ankle, or if you had like a really tight watch or bracelet that's cutting off on the arm, that would be not recommended for any kind of risk of swelling condition. Another question is, will the condition go away? So unfortunately, the lymphedema is described as a chronic condition. So it will take a lifetime commitment to really pay attention to the swelling. The good thing is that there are a lot of treatments that can address the condition. I think people struggle with, at least from our perspective, it feels like I see people kind of fall off the wagon if they're not as compliant with wearing their compression garments, or they maybe if the garments are worn out and then they let them kind of stay worn out without getting them replaced on time, then their leg or their arm gets bigger in the meantime. But if you're working with a therapist, that therapist really should be responsible for telling you, these are the things that you would do to control your swelling and keep it at this level, because we want to help people maintain the progress that they've made up until this point. So the patients, I think I was saying this before, the patients that have more of a severe condition, that would be, it would take more time to make progress. But I think from a learning perspective, at least today, I think a take-home point would be learning what to be on the lookout for, and how to manage the symptoms in case this happened. The next one is, patients will tell us that they look some things up online, and we would caution against that. Not everybody is the same, and not every treatment plan is the same. We've got to really tailor it to the patient specifically. There are some extreme cases that are listed out there, so I wouldn't want someone to feel fearful to come to us or fearful to get the education. An untreated condition would cause problems and could turn into big changes in the skin. But the example of this picture, this would be like in a very extreme case. This is not what people look like that we see on the regular. I mean, here or there's a more severe case, but then there's a lot of great cases where patients will come in and say, I have a little bit of swelling and my arm feels funny. Can you help me? So it really goes, it's a whole spectrum. Oh, sorry. Yeah, there's the picture. Yeah, that's an extreme case. Another question that we get, patients have familiarity with compression sometimes after a hospitalization, and they wear these white Ted hose or white stockings that are uncomfortable. And I think from a medical perspective, like a hospital perspective, they're trying to prevent blood clots, but the compression garment that we're used to working with is different than those white hospital stockings. So a compression garment would be helpful to contain the swelling. That's really the goal, but the therapist is responsible for selecting a kind of garment that fits the patient's needs and properly fits their size and shape. The therapist would be responsible for recommending a certain level of strength or containment. It's called a compression class. And then the therapist would be responsible for really problem solving any kind of containment issues. So from our perspective, like, I think that's on our shoulders to teach people what our job is. But then when you're at home or dealing with a compression garment independently, we would be telling you the things to look out for. So I never want someone to feel like they're kind of in this independently. I want them to feel comfortable with asking questions and going over things with me. But I think as a therapist, we need to tell you what the most important things are so that we really find a compression garment that's right for you. Because if a patient isn't compliant with the compression, then it feels like they're always going to have the swelling condition. But I try to help people understand that although this is such a maybe a bothersome condition or a time-consuming condition, there are a lot of treatment strategies that are out there that can really help contain the swelling so you don't feel limited in your activities or like your leisure-based activities or in what you want to wear. So there's lots of variety to really help people get to the point where the condition is well managed. Okay, this is probably the most common question I get. Patients will ask, can you just stick a needle into the area and suck out the extra fluid? The answer would be no, unfortunately. That would risk more issues like infection. You don't want any openings in the skin. One of the things that would be important to note is I think I was talking earlier about how the lymphatic system has proteins in it. So if lymphedema is described as a condition with protein-rich fluid, and protein loves fluid, the proteins in our bodies looking to suck up this extra fluid. Removing the fluid will only cause the proteins that are left behind to generate more fluid. So this would be the opposite of what we want. So the way to treat this fluid that's sitting between those vessels that I was talking about earlier would be compression and manual lymphatic drainage. So that would be how to get the fluid that's sitting in the space in the vessel so it can go from the lymphatic system to the circulatory system and then eventually to the kidneys, and then eventually you would urinate it out. So it has a process to go. It's just a little bit more foreign to people because they just might be like, well, I have this swelling condition. Can you just drain it for me? It's different than like draining a knee that has fluid on the joint. That's a totally different thing. So that would be a common question that we get. Another question is, and we should be responsible for going through this with a patient so that they know what they're getting into when we're going over a treatment plan for full, I think I was mentioning earlier, intensive, complete decongestive therapy. If a patient needs bandaging, they might be in bandages from anywhere from like 4 to 12 weeks, which is a really big commitment. So a patient would come to us like 3 times a week. They do several weeks of bandaging, however long it needs. And then at that point, we would order compression garments. And then you have to wait for the garments to get here. So then you still continue your bandaging until the garments are here. So that's what lengthens it. And like I was saying earlier, there's a big variety of patients that we see in all of those different stages. So it's not really an exact number of weeks. It really would be a plan of care that's designed tailored to the patient. So the condition I mentioned earlier is a chronic condition. So it would take self-management for the long term. And then within the beginning of a plan of care, a patient might be totally new to us, like new to the clinic. They're not really sure what lymphedema is or what to do with this. But then once we give them their home program, they're doing pretty well. We might not see them for a while, and they just might come back to us for compression garment training. So usually I'm phrasing it as if a patient really needs the more intensive route and of doing the bandaging first, I would phrase it as like you're doing the best thing for your body right now. And I know it is a commitment to come here so often and see us so often and do this bandaging program for a number of weeks. But it's really like once you get the swelling under control, if everything is the same medically, hopefully that you just are committed to this the one time. And then from here on out, you're just going to be doing garment replacement in the future. Yeah. And we do sometimes meet patients that intensive programs just not quite right for them. So they might say, I don't think I can come to the clinic 3 times a week. So what do? We would just say a few options. I would describe it as lymphedema is not an emergency. It's important to be committed to therapy when it's right for the patient. And sometimes with like maybe vacations or a work schedule or a family schedule, sometimes it just doesn't work where they can come that frequently to the clinic. I would say that if a patient really needs some things, there's a few ways around it without having to do that intensive 3 times a week. So we could still treat someone for a short period of time. But if they ultimately need something like bandaging and they need to come to us multiple times a week, I would say just do that when it's right for you. And then the program should be tailored to the patient when they're ready. I do also use that quote of like, we're not going anywhere. I might say to a patient, like, you've had this condition for a little bit, take care of what you need to take care of. Sometimes people are inundated with appointments and it can be overwhelming to add one more thing. So we would just say, we're ready for you to come back when you're ready. I think the patient that isn't quite ready, it's not as easy to make progress if we don't see them. We want someone that's able to come and see us consistently because we just want to closely monitor for progress and then problem solve if there's anything that we need to tweak or work on. So if you're looking for the treatment, I would just say, think about like your routine and your schedule and like what works for you, because the therapists are going to always be there to support you. And then for lifelong management, we joke with our patients that you've made a new friend because you will need to replace garments in the future. Then you just call us and the therapist would do the fitting for you, help you get your new items. And that's a few appointments. It's definitely not as intensive. If everything is status quo, that next or those future plans of care are often much shorter. It could be a handful of visits. So it's very different than that initial really intensive treatment to get the swelling down. It is an effective form of treatment. It really does work, but patients are mostly trying to understand, like, what is this condition? Do I have this condition? What can I do to prevent it? What can I do now that I have it? And those slides that we were talking about earlier, like what is the lymphatic system? So I think it's important for people to understand those basic tenets of the diagnosis or the condition. But it is something that patients, I think, learn the most about once they step into a clinic. I think they get referred to us from providers that have probably another laundry list of things to work on or talk about. So I think we get a good stream of people coming to us appropriately. But when you're spending several sessions a week or several sessions across several weeks with the therapist, when you have the opportunity to understand the condition and ask the appropriate questions and really get a handle on the condition, I think that's when the learning curve goes up and you're like, wow, a lot of people say, I didn't even know about this. So I'm glad that we're there to support people and especially work in a cancer center building, because I think that's an appropriate avenue for like lymphedema treatment center. And that's pretty much the scope of everything. There's a couple of general, I think these websites are pretty user friendly. I do talk about the National Lymphedema Network, the Lymphatic Education and Resource Network, the Lymphedema Treatment Act. That's something that changed in 2024, where patients with Medicare can get compression garments at least at 80% covered. So that's great. That was a big new progressive thing in our world, because a lot of patients now can get some garments with some good coverage. And then 2 other resources would be the National Comprehensive Cancer Network and the American Cancer Society. I do think that looking at information online can be overwhelming, but if you have a few good resources that are user-friendly and reader-friendly, I think those are some good ones to use. Also in the room, we have a few papers circulating around just about the lymphedema condition in general, some different things to be on the lookout for. And then if you ever need anything from us, we have a paper with our address, our phone number, like our scheduling tool in case you needed to call in to make an appointment. And then we have some business cards that we could leave with you, or leave a few copies with you of these things, just in case you have other people that you want to share this with. But that's pretty much the gist.
Okay. And we did have a question in the
Okay, sure.
Can you get lymphedema in your abdomen area if 17 nodes were removed from Whipple surgery.
You can get lymphedema in your abdomen. There are a lot of lymph nodes in that area. So typically we would tell patients, just kind of in general, anytime the lymph nodes are removed, that would be an impairment to the system. So that could cause congestion. And then sometimes with surgery, if you think about like a doctor that has to make an incision and those lymph vessels are living very superficially right under the surface of the skin, they have to actually go through those lymph vessels too. So the system is smart enough to kind of reroute if some of the vessels are cut. But again, that could cause some congestion because it takes time for the vessels to kind of reroute the fluid because there's now a big incision line. That's a good question.
Yeah.
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 Mhm.
Okay, when you said, well, when you said that 90% of that fluid
Mhm.
is in the cardiovascular,
Mhm.
and then 10% is in the lymph system,
Mhm.
but the lymph system goes to the cardiovascular. If
Mhm.
you have a patient who already has something like a congestive heart failure,
Mhm.
even in the beginning,
Mhm.
does that impede or give a
Yeah.
greater likelihood that they'll get lymphoma?
I think that's a good question. Yeah. So if we did meet a patient that has a very acute change in, like, say, a congestive heart failure situation, we would have to maybe say, let's hold compression therapy because we don't want to move a bunch of fluid and overwhelm the heart. If it's a well-managed diagnosis, like say they've had congestive heart failure for a long time, and again, I'm not a doctor. I'm just saying about like my experience
Right.
from a lymphedema therapist. If it's a well-managed condition, you still could move fluid with compression therapy, like bandages or garments, but you'd have to do it in a very conservative way. So we'd have to use less bandaging or less pressure, or just jump to those Velcro garments that are very offering like a gentle level of compression because we don't want to overwhelm the system. So if I see that a patient has congestive heart failure history of it, then I have that as something to keep in mind or ask more questions about, like, is this brand new? Did you just get out of the hospital? Like, what's going on? So I have to dig a little bit more before I'm recommending what to do with that. But with that condition, we do sometimes get referrals from cardiology because the patients might have swelling on like their arms and their legs. So again, you can potentially proceed with caution, but it really depends on the patient. But that's part of our training of what we would need to know about the red flags of when to totally hold therapy or it's okay to proceed with caution.
Thank you.
Yeah, sure. So they're good about helping us understand like when to safely move forward. Mhm.
All right, so we have a question online. Are there any new developments in treatment or cure, like transplant of lymph nodes?
It's a good question.
So that first, and then there's another one.
Okay. I know within our system, we don't have someone that's doing the transplant of the lymphovenous bypasses
Yeah.
at Christiana, but there are surgical options. I don't know of like a provider name off the top of my head, but there is a way to do a surgery to help decrease the amount of congestion. I've heard from patients, and maybe you have had, I haven't met anybody personally that has had this, but I know one of our colleagues was mentioning a patient that had the surgery that didn't really have like a ton of great success. But again, it's probably case dependent. And I personally don't have any experience of meeting someone that has had a surgery that, that has had a surgery period. So I would have to do a little bit of digging to see. I think there was a provider, I want to say, at Johns Hopkins in like the Baltimore area, but I don't know off the top of my head like who that would be. I would have to really dig through and find it.
I can touch on it a little bit, Megan, and for everyone at home, this is Shelby, also from the Holly Graham Center. So currently at Christiana, we don't have a provider who's giving these surgeries currently. It is something that they have on the horizon, but in terms of locally, John Hopkins, correct, Penn, Fox Chase, essentially there are two or new surgeries, like Megan mentioned. There's the lymphovascular procedure where they're basically rerouting the fluid movement by adjoining lymph vessels to your venous system to help move fluid. And then some providers are also performing a surgery where they're taking lymph nodes from another area in your body. So for example, if you had a breast cancer and the idea was they were maybe taking some lymph nodes from your axilla or your armpit, they may take lymph nodes from your inguinal region, your groin region, and then transplant them to the area that will be affected. Essentially thinking, okay, well, we'll have now more lymph nodes back into the area that we're removing lymph nodes from to help with that filtering, to help with that process. Typically, we're seeing it done often at the same time as that surgery is being performed. So if you're having an axillary dissection or a sentinel lymph node biopsy, they're trying to do both procedures at one time. However, there have been cases where patients have already had the procedures. We know that, let's say maybe in that armpit, 4 lymph nodes were taken from the left side, and they will later date go back and go to another area where you have lymph nodes and remove them. They use a special dye in your inguinal region to see what lymph nodes are the most active. They leave those because you don't want to rob Peter to pay Paul, right? Like you don't want to develop a lymphedema in the leg because you took the most important sentinel lymph node. So they find other functioning ones that aren't lighting up with that special dye and putting them to the area to help drain it. It's more or less seen with patients who have had some type of surgical procedure to their lymph nodes, because as Megan mentioned early on in the presentation, you can develop lymphedema not just from cancer treatments where we see it most often, but it's actually hereditary as well. And so it's a little harder for physicians to determine where there may be a dysfunction in your lymphatics if it was something that you were born with. So you don't often see those procedures as much as you might with somebody who we definitely know had X, Y, and Z amount of lymph nodes taken from an area due to a cancer diagnosis. But we're definitely seeing it more, and had some better results in the last few years with it too. I've seen some pretty cool stuff out there.
So the next question was how to get funds for garments from Medicare or insurance.
How to get garments through Medicare insurance. So you would, there are a couple of things that Medicare, and this might even probably on that Treatment Act website that we had on the other slide. So there's a couple of different things. We need a signed prescription from a doctor with certain diagnosis codes. And then you would work with a vendor. There's a few online resources that takes insurance, and they act as a vendor where they would interpret someone's insurance, let the patient know how much coverage they have, and then how much the garment will cost. Sometimes patients get garments for no cost because their secondary picks up that remaining 20%. So that first Medicare insurance coverage that they have takes the 80, and sometimes patients have a great secondary and that takes the other 20, and they can get their garments at no cost. That's patient dependent, of course, but the good thing about that Lymphedema Treatment Act is now with Medicare patients, they can get up to 3 items per area every 6 months. So that's a lot of garments. So that could be like 3 gloves and then 3 sleeves in January, and then 6 months later, 3 more gloves and 3 more sleeves in July. So that's nice that it's actually pretty generous coverage. That was a big thing in our world when that changed in 2024. Yeah.
So
They're not cheap.
durable medical equipment.
Yep, durable medical equipment. So there are certain vendors though that just deal with lymphedema garments. There's a lot of vendors out there, DMEs, but they don't always work with compression garments. So if you don't have Medicare, one thing you can definitely do is call your insurance provider. And they should have a list of what DMEs they work with that are in network with your insurance. But most definitely, most of the insurances need a prescription from your physician with a lymphedema code on it. And sometimes office notes from the physician as well to order them.
Mm-hmm.
Yeah, and just a note from Cancer Support Community Delaware, we do have something called the Insight Cancer Care Assistance Fund. It is really not created for things like this. It's really for if you're struggling financially because of all of your cancer treatment. But sometimes people have come to us and said, can we use this to pay for a compression garment? The problem is that the fund we have will pay a bill directly. So if you were needing to free up some funds to buy your compression garment, you can apply and maybe ask for your rent or mortgage or another big bill you may have, something that we can that we have a bill for that we can pay, and it frees up some funds so you can do your garments. We have done that with some patients. So that's another way around if your insurance is not paying.
Yes.
Oh, that's great.
So we did have, I wanted to just say, someone did mention they did have LVP last week. Sounds like MSK. There's a doctor doing it. Here's another couple questions in this one. If you get some swelling following a blood clot, is that the same as a lymphedema or a different mechanism? Would the same issues apply? Also, how likely is it you will experience lymphedema? You'd experience lymphedema would occur if you only had one or two lymph nodes removed. So I think two separate questions.
Yeah, sounds like two separate questions. So we have had patients that have a blood clot. If it's a new or active problem, you would want to hold compression. You don't want to spread that clot somewhere, send it somewhere else. If a patient has a history of them, that would be also something for us to know. So if there's a history of clots, the treatment could be potentially going forward, but you would want to keep it in mind to treat conservatively and just know that the swelling condition might be showing itself a little bit more if there's some slowing in the venous system, for example. Hopefully that answers that question. And then can you please remind me of the second?
And then the second part was, how likely is it you would experience lymphedema if only had one or two lymph nodes removed?
I think a good thing to keep in mind is you know what lymphedema is. You could be on the lookout for the signs and symptoms of lymphedema. We do have a handout here, and maybe we could either leave it here with you guys just so you can. It's a self-monitoring handout of how to look at your arms, for example, to really self-inspect. Not everybody has lymphedema that has one or two lymph nodes removed, but it is important for the patient to understand how to self-monitor and be on the lookout for the swelling condition, because untreated swelling is harder to move than someone that notices it right away, or they notice those symptoms of like, my arm feels a little heavy, a little different, a little achy, even though it might not be bigger than the other arm, it still is important to be on the lookout for. So you could have a swelling condition with a few lymph nodes removed, but you might not. It depends on the patient and their system. So
Can I touch on that? Okay.
sure.
I was gonna say, all of the resources you brought, if you can provide them by
Yeah.
email to me, I can
Totally.
include them in the, when I
Oh,
set up the
perfect.
recording too. So everyone who was registered here today will have an electronic copy too.
Can I just follow up, because I was the one who asked about the blood clot? I guess what I was wondering is, would like lymphatic massage, it's not a new thing, it's 10 years old. So would lymphatic massage help if you get a little swelling in that leg, or is it entirely coming from a different reason that that wouldn't work?
They are interrelated. So manual lymphatic drainage could be an effective treatment intervention. Because if there's any fluid that's sitting around those vessels, whether they're lymph vessels or veins, you would want to get that fluid out of there. So if you saw a certified lymphedema therapist that could do the manual lymphatic drainage, I think that would be an appropriate intervention, as long as it's not a brand new problem.
Yeah. And I don't want to get too much in the weeds with it, Judy, but essentially, if you've had a blood clot, and it's especially a chronic one from 10 years ago, your venous system and your lymphatic system work a lot together. So I like to say your venous system is kind of like the starting team, and your lymphatic system is kind of like the second string. So essentially, when your venous system is normally working, right, it's bringing that blood flow back up, that deoxygenated blood is coming back up. But over time, if we have any kind of venous insufficiency or venous issues, or have had a history of a clot where now you might not have as great of that return of blood flow, you can get some of that leaking into the system. And that's when that backup, that lymphatic system tries to help and to suck up that fluid and also help to circulate it. But there's really not a third string behind the lymphatic system. So once your lymphatic system is overcompensated and it can't take on any more fluid, we sometimes see that chronic buildup of fluid with any type of venous disease. So same mechanisms that we would do for your lymphatic system, whether it's compression or massage, can be helpful. Again, as long as it's not an acute clot or something that hasn't been treated. But that's a really good point. So I'm glad you brought that up, Judy.
And that's sometimes covered for insurance, even.
Yes.
Yeah.
Yep. Yeah.
Right.
As long as again, as long as your insurance does provide coverage for compression garments, and most insurances just require, again, that you have that prescription from your physician. And sometimes some insurances do require notes either from a therapist or a physician as well for the garments.
And what about for lymphatic drainage, like massage? Does that get covered too, did you say?
So it gets covered to an extent. The idea is, we have to teach our patients how to self-manage. So typically would have patients come in, we would perform the manual lymphatic drainage and bring them to a point where they would be able to do it long-term. Now, if it was something that was more of a patient just wanted to come for lymphatic massage, indefinitely, insurance wouldn't cover it at that point because they don't consider it like a skilled service. It's more or less something that we would perform, teach it to you so you'd have it for long-term maintenance.
Thanks.
It's for long-term maintenance. Can you go backstage, or is it like most chronic things where it just continually progresses and you're arresting it? Or can you come in stage 3 and have it bumped all the way down to a manageable stage 1?
Yeah, I think
Does
it could
that
go in a better direction. Yeah, with consistent intervention and the right treatment,
Okay.
I think it can get better. You're right. The word chronic sometimes means things are going to just completely get worse over time and it progresses to a bad spot. But with the right treatment interventions, lymphedema can be, it changes the skin texture, the limb hopefully gets smaller, hopefully it has a better shape, and then it gets to a point where it's managed as well as possible.
Okay.
Yeah, that's pro.
Can I ask a quick question? Oh.
Compression sleeves. I only wear them, I don't wear them every day, all day. I wear them when I exercise. I wear them if I'm doing something like ironing, which I know don't get on, I still iron. But
You do, girl.
That's your point.
Yeah, you come to my house.
Come
to my house.
It, but like tomorrow, for instance, I have a really long day, like busy day from morning straight on through to exercising not until 5 o'clock. Can I put my compression sleeve on first thing and just go through my day?
Yes. Yes, we would typically recommend garments to be worn 23 out of 24 hours a day. So patients these are the things that they have for their day options, and these are the things that they sleep in. So you would really just be taking it off to shower. It would be our most conservative recommendation. So I'd say most of our patients get that recommendation when they're working with us. And then over time, if you're noticing that it's pretty well controlled, then you can potentially taper off of it. But if it's a day where you have like a lot of activity and you know that arm's going to be moving a ton, yes, I would say that it would definitely make sense to put on your sleeve ahead of time before your busy day, because that will help control the swelling and contain the swelling versus you don't have it on, then it's swollen, and then you're trying to get it back down. There's more ground to cover that way versus you're just containing it from the start of your day.
Thank you.
And Gail, did you have a question online?
Yes, thank you. I'm seeing a lymphedema doctor through my cardiologist office. And he did an ultrasound on my legs and found that the iliac vein in both legs that attach, I might be wrong if what I'm saying, but they attach in the abdomen area is usually shaped is open like that for blood to, or for, it to flow through correctly. And mine are like smashed like a pancake. So he's going to do like a venal clap. Is it venal clap? I don't know, but he's going to put stents in to open it back up. Will that help my lymphedema?
It should, hopefully.
Yeah.
I don't know that I can speak from a doctor's perspective if that's what they're recommending, but we do see patients that have had procedures on their legs, for example, and then the providers trying to do these procedures to get better flow. That should ultimately help the swelling condition because, as Shelby was saying earlier, the two systems work very closely to one another. So if the veins are working more efficiently, that should help take the load off of the lymphatic system. So there's less fluid just sitting in those spaces.
Okay.
Hopefully that answers your question.
Yeah. Can I just follow up with one more? But please tell me, if I need to ask, a doctor this question or whatever's fine. But I'm like managing a lot of like doctor appointments and procedures like on my own, and it's kind of getting like overwhelming for me. But I'm supposed to have like a hysterectomy scheduled like real quick from the high risk GYN at Helen Graham, and also had this venal clap procedure around the same time. And so will one affect the other? Like if they're doing like a hysterectomy, is that going to like affect where the iliad is attaching in the abdomen? I just don't know, like, should I cancel like the lymphedema stuff until after the hysterectomy? I don't know.
I wouldn't want you to be overwhelmed. I think people, I want them to feel comfortable with coming to us without it feeling overwhelming. I want it to be a positive experience. I'm not sure, like from a doctor's perspective, how they would answer that question if one procedure is going to affect the other procedure. I think from a therapist perspective, any kind of surgical intervention or procedure that's addressing the veins or like a stenting procedure, for example, that could hopefully help with flow. I think the things to be on the lookout for if you weren't able to make it to the lymphedema clinic, you would be just looking for those signs and symptoms of swelling, and you could work with a therapist. Like even if you couldn't come, for example, 3 times a week, you could work with a therapist and say, I have these things going on. Kind of what do you think would be your recommendation for right now?
Okay. Yeah, thank you.
So, yeah, let me ask you a question. Were you also wondering if you should have if you should hold on the venous surgery until you've had their hysterectomy? Was that part of the question too?
Yes,
I think that was.
yes.
I mean, I would definitely ask your gyn-onc first, but from a standpoint, what I would think, and it's the same thing Megan mentioned, your surgeons might have a different viewpoint on it, but anytime that you have any kind of surgery, which we consider a trauma to the body, it can absolutely affect your lymphatic system. So something like a hysterectomy, which sounds like it's a really important procedure for you to have done, and maybe more of an ASAP procedure and something that you do have completed before considering having anything venous. One, it might be more medically necessary, but two, it could create more scar tissue and potentially further impact a lymphedema. So it may be beneficial, and at least from a lymphedema standpoint, to have a procedure like that first, so then you can see what its effect would be on your lymphatics and even your venous system. So, I mean, I would definitely consult with your physicians, but I don't know if that answers your question.
Yeah, it does. Thank you.
I think that you had a question too.
Yes, mine's almost like a double whammy because I'm also an MS patient. Okay, so that comes with its own little complications. I have a dear friend who is an acupuncturist and a massage therapist. So he showed me some things, how to kickstart the sludge to get it moving. And it has been helpful with my ankles used to swell, and I don't have that anymore, very minimal. So when I get up in the morning, I just start banging on myself, and
Oh my God.
yeah, squeeze, it looks silly, but I feel it does help me, it helps me,
That's good.
because I don't know which is aggravating which, you know what I mean? I know that the MS affects the nerves, but that itself could start things up. So I just like start attacking when I wake up in the morning,
Oh my gosh.
to get my day, to get my day. The only thing that I have to do now is really pump up my activity, maybe walk a little bit more.
Yeah, that would certainly help flow and movement.
Yeah, physical activity does help.
Yes.
So I have to like pick up my activity, but yeah, that helps.
Yes. Yeah, that would
That
go
helps
along
me.
with one of those.
The certain points
Yeah,
help, and things that I do with my fingers and stuff and get things moving,
yeah.
And at first I thought this is silly,
Mhm.
but after a couple of weeks, my ankles didn't swell up. They might just get a little puffy on the top, I just massage, and that goes away. So I guess each person has something, not only know where their weaknesses are, but where their help is.
Yeah.
So that might work for me, maybe not somebody else. But everybody knows what works for them. So that works for me. So I'm gonna continue doing it if that's okay.
Yeah.
I'm gonna continue doing it because it does help me and try to get as much fluid in me as I can, especially water, help my kidneys. You know what I mean? So because I'm always under attack from one,
Yeah.
so I have to look out for the other.
Yeah.
So.
Yeah, it sounds like what you're doing is working, so that's a good thing. And I think you hit on two of those main 4 points of the home program, which would be manual lymphatic drainage and exercise. And then when we exercise, we're using our natural muscle pump, and the vessels of our lymphatic system sit above that, right under the skin level. So when the muscle bulks up and we're using it with like walking or doing the stairs, using our arms to do stuff throughout the day, when the muscle gets bigger, it's actually helping some of that fluid get pushed along in the lymphatic vessel. So movement is great for fluid management.
He was the one that taught me about the center. So I'm sitting there watching TV.
Jeopardy's on.
Get the moving, get the moving, get the moving. But she's the one that told me about, explained to me
Yeah.
about the railroad system.
Yeah.
Yeah.
And just and keep moving. So I try to remember.
It sounds like you do.
Well, yeah, it's whatever your friend, your acupuncturist and the massage therapist, it sounds like you're hitting some of those areas, like where those lymph nodes are.
Yes.
To kind of stimulate the whole system.
Yeah.
So that's really good.
Pelvic on the
Yeah.
side.
Yeah.
Around the knee.
Yeah.
Uh-huh.
Ankle.
Good job.
I look like I got doing some kind of dance. So of course I'm by myself when I do this. I try not to be in the presence of my family.
They might learn something though. Yeah, there you go. Yeah, exactly.
Yeah.
Shock the family in.
Well, I'm gonna wrap up the Zoom part of our meeting. If you guys have additional questions, on the way out here in the room, we could certainly still cover that. But thank you online for joining us.
Thank you.
Can I throw one more thing in before we get logged out? Just a really general thing, and I think Megan did a good job hitting on it. Someone asked a question about, I had 2 lymph nodes, I think, dissected, could that make a difference? I think the biggest point that we try to drive home to patients, especially those who are oncology patients, is we know you have appointment burden. We know you have a lot going on. You have a million different side effects, treatments, things that are being thrown at you. And at different points during your care. It's not all in the beginning, it's not in the middle, and there's lots of things in survivorship. And lymphedema can occur really at any point. And I think that's sometimes a misconception, I didn't have it after a year, I can't develop it. It can happen. So just no matter what symptoms you notice, please, please, please bring them up, because it doesn't always look like a big swollen neck or leg. It sometimes presents itself, like Megan said, with just a heaviness or a weird pain, a weird ache. It's different from your other side. And, even your physicians, they're trying to prescribe a lot of things to you. And so sometimes it gets missed with them too. So just bring up any symptom that does not feel right to you, no matter what point of your treatment or survivorship you're in. And then, really we have to be our best advocates no matter what in the end. So just make sure you bring it forward, make yourself heard, seek your treatment, because it definitely is more beneficial to get treatment early on versus later on in a stage. And like this person asked about 2 lymph nodes, you can develop lymphedema with no lymph nodes taken and something like a lumpectomy, and you can not develop lymphedema and have a full axillary lymph node dissection. So there are lots of factors that go into it, and some things that we can't change, whether it's your genetics, your family history, your body weight. There's lots of things that go into it. So just mention any symptoms that you might have, because the sooner the better with treatment.
Can you just remind me of something, like my doctor, when I had a couple lymph nodes removed from under my arm, my doctor said I shouldn't have any issue like getting my blood pressure taken or blood taken in that arm. But then when I went for chemo, I know my oncologist didn't want that arm used. And like this was, again, 10 years ago, those lymph nodes were taken. It wasn't a new thing. Is that something you suggest people avoid, is the blood pressure and the blood and all that stuff?
Yes, we do make it a point to go over some, like we call them lymphedema precautions. So the blood pressure cuff would fall under that list. Avoiding needle sticks, like your flu shot, for example, on a certain arm, that would fall under that list. There's other things like taking care of your skin, like using sunscreen or using bug repellent. So there are a handful of things that would fall under the precautions list that we would go over.
Even like something old, like I wouldn't want to have my flu shot taken in my arm.
I think it would make sense. What do you think?
Yeah, there
I
are-
think it makes sense.
Yeah, there are some mixed studies out there. So have been some studies that came out that said, didn't really matter what arm it was on, whether you had lymph nodes taken out. But some of that research wasn't the greatest research. So really the gold standard still is if you've had treatment on a particular side due to cancer with, radiation or lymph nodes taken, you should really try to use the opposite arm for anything like a flu shot or a blood draw or blood pressure. That's still really the recommendation, to err on the side of caution.
Okay, thank you.
All right, again, thank you everyone for joining us and thank you, Megan.
For sure. Thank you to everyone online. Thank you to everyone here. I appreciate it. Thanks for having us.
Yeah, thanks for having us.